like okay. So it is also recognized by Government of India as a research yoga research institute. Okay, so that's the background of Shivadarshan Yoga Vidyalaya. And just a couple of lines about me. My name is Vijaya Lalita, Viji by short, and I've been teaching like yoga therapy with Shivadarshan Yoga Vidyalaya since 2016. um, I have like personally experienced the benefits of yoga. I was able to overcome a lot of my health issues through yoga. So I wanted to learn more about that, and then and then it became my passion. And once I actually experienced the benefits, because when allopathy failed me, I was able to get benefits through yoga therapy. So it became my passion to spread the word, to teach so that more people can be benefited through yoga therapy, right? See, allopathy is always good for like emergency, or if you want like immediate pain relief and things like that. But for long term, if you want to recover fully, and if you want to continue your life without medications, yoga plays an important role. So those are the techniques that we teach in Teachers Training Course 1 and Teachers Training Course 2 and Teachers Training Course 3. So we have different Teachers Training courses. So I'll give like a small introduction about what we cover in Teachers Training Course 1. So we basically cover the very most common diseases of these days, the modern times, that is like asthma, diabetes, hypertension, as well as spondylitis. Click on OK here. Okay. So, why we are having all these problems nowadays, right? First of all, I think like the technology has changed the whole thing, the way that we live, right? In earlier days, there was a lot of time to relax. Everybody gets busy, they do a lot of strenuous work, but then they also had sufficient time for relaxation. But in the modern times, what happens is that balance is being lost, isn't it? I think we all know. Even the free time nowadays, we just start scrolling through the gadgets that we have, like mobile phones or laptop or whatever that we have. So mind is constantly very, very busy. So what happens is our nervous system, right? Like we have in the autonomous nervous system, we have like the sympathetic nervous system and parasympathetic nervous system. When you're doing a lot of work, you want your sympathetic system to be working, but when you at the same time, when we rest, the parasympathetic system kicks in, and then rest, repair, and all that happens. But because of the lifestyle and too much stimuli to our brain, the constant stimulation to all the sensory input, right? This balance is lost. Our sympathetic is overactive, which leads to imbalance in our nervous system. See, when the nervous system is like balanced, because the signals from the brain, right, it goes through all the organs through our the basically all the command center is your brain, and it sends the signals through your spine and then to all the organs that are connected, right? Everything receives the signal and they do their job. But because of that imbalance, then the system slowly begins to fail, in the sense, slowly, a little bit it begins to malfunction. Eventually it leads to chronic disease, right? Such as like diabetes or hypertension, whatever. Even asthma has the root cause, there are different causes. But nowadays we all know that 80 to 95%, sometimes I say, or they say different variations, 70 to 80%, 70 to 95%, most of the diseases are stress related. So in stress, what really happens is this imbalance actually happens in your nervous system. Stress is actually like caused because of our how we are able to handle things. So we need to bring the balance to our system overall, and that can be achieved through yoga therapy. So what are some of the techniques that we use like in yoga therapy? We have like so many tools, like we can, I think everybody is very familiar with asanas, right? In asana, what exactly we do? We do a lot of stretching the body, and we also some asanas are like stretching, some are strengthening, and some are like relaxing.
Topic
When we
வரவா?
hello, yeah. Okay, I think somebody went, I think got unmuted, right? So we do, okay. So we are basically like energy bodies, right? In yoga therapy, or like we say prana, right? Prana is the basis, the subtle life force. Okay. According to yogic philosophy, okay, so I was talking earlier about the nervous system, which is more, to resonate with the allopathy system. Okay, but in yogic philosophy, disease is caused by imbalance in prana. So, what is this prana? So, when we inhale oxygen, we also inhale the cosmic prana, right? So, like I mean, we all say like when somebody dies, we say the prana has left the body, right? So that is the life force which is in us, okay, which is actually operating. So the prana, it flows throughout our body, and we call it by different names based on which part of the body the prana is functioning, just for like classification, okay? So the prana that works in your lower abdomen, we call it as apana, okay? Basically, that governs the functions of the organs that are situated in the lower abdomen. If the pranic movement is blocked or restricted, then, okay, in a particular area, those organs will not work efficiently. For example, like lower abdomen. So females, we have like uterus, right? So if the prana in that area is not moving properly, we will have problems with related to like uterus. Like some people can have like infertility or PCOD or whatever, right? So how we can restore the balance of the prana in that area? So we are going to do that through asanas, pranayamas, mudras, etc. Okay. So how exactly, so all these asanas that are given for a specific disease, they try to restore the pranic balance in that particular area. So if somebody is having a problem of asthma or heart related problems, then we know that the pranic movement in the chest area is not, uh, it's not flowing freely. So there is some restrictions, which could be from like, physical tension, or it could be from emotional tension, or it could be from mental tension. The different causes, okay, it could be from lifestyle also, okay. So different causes can actually cause restriction or problems in the movement of the prana, which actually leads to chronic diseases eventually. So our goal is to restore that. And how pranayama comes into the picture. So asana basically stretches, it tries to remove some of the blockages so that the pranic, movement can be restored. Pranayama is like expansion of prana. Okay. So sometimes we only have less prana. That means we need more prana, right? So okay, you are like removing the blockages in the pathway, but then what if you are having only less prana? So how do we increase the amount of prana, right? So you can do that through the practice of pranayama. Okay. Also, if you all, I think there is also like a belief that in naturopathy, accumulation of toxins in the body, because different systems have like different theories of how disease comes into picture. Like naturopathy says, like accumulation of toxin leads to diseases. Ayurveda says imbalance in the elements, right? The five elements like akash, air, and all of that. If there is an imbalance in the elements, then disease actually occurs. So by if you actually analyze each of these practice, right, or mudras like pranayamas, each one works on these elements. So some, for example, like Bastrika Pranayama actually brings balance to three dosha. That is, it brings balance to all the five elements. Okay. So we can also like when we teach therapy, right? You need to understand the different causes, and then how we can address it. Each and every asana and pranayama actually works at different levels. When you understand that, then when a particular person comes for a particular ailment, you can advise them, you do this, you can do this pranayama, you can do this asana, so that blockages in the nadis. So what I mean by nadis is like in the nervous system we call it like nerves, right? So in the yoga, the energy flows through nadis. Okay, so sometimes there could be blockages in that also. So when we are doing like asanas, lot of stretching, we are actually removing those blockages. And then through pranayama, we are increasing the amount of prana that is available. If somebody, for example, is having like diabetes, that means prana to the pancreas is not working properly, or the entire digestive system, right? Like there are different organs involved in the digestive process. So if somebody is having diabetes, so the asanas and pranayamas that we give will be addressed towards that, how to restore. Like there'll be a lot of squeezing movement, like in the asanas, if you see, which will actually massage the internal organs in your abdomen so that the pancreas will get stimulated. Because some of the causes are lack of insulin production, or not enough, not sufficient amount is produced, or it could be produced at the wrong time. So when you're doing the asanas and pranayamas, we are trying to restore the balance in the pancreas so that we can eliminate the either lack of insulin production, or insulin getting produced at the wrong time, and so on. And the third one that I wanted to mention is like I talked about the balance between the sympathetic nervous system and parasympathetic nervous system. So there is this imbalance. So how do we bring balance to it? Like the sympathetic is overactive and parasympathetic is less active. That is stress, the fight or flight response is more, and the relaxation is very less. So we need to bring relaxation more so that the fight or flight comes down, and then the nervous system is balanced. Okay, so there are a lot of like relaxation techniques that we teach. The deep relaxation you can get it through yoga nidra, the technique of yoga nidra. Okay, it's known as psychic sleep. It gives like a deep relaxation. It works on different tensions that are in the body, physical, emotional, etc. Okay, the deep relaxation actually brings the balance. The nervous system imbalance that I talked about, that balance will come. You will get the balance. And then we also teach like antar mauna techniques, which is kind of like a mindfulness technique, vipassana meditation, if you're aware of it. So in that technique, what we teach is like you become aware of your mental patterns. I think it is also believed that a lot of like I said that like 70 to 90% the statistics varies of the disease, right? The root cause of the disease is stress. Where stress originates in your mind. In yoga also, a lot of disease have the root cause in manomaya kosha, which is in your mind. But sometimes the patterns that we develop, we are not aware. Sometimes we would have developed it at a very young age. Sometimes some of the karmas that we are carrying from the past birth, right? They also play a role. How you react, how you behave in this particular Janma. And you need to break that pattern. But in order to break that pattern, first you need to become aware of that pattern. How do we know if you're constantly looking at your mobile, or if you're constantly engaged in talking with somebody or watching TV, you will not become aware of what's going on in your mind, right? A lot of times we are not able to actually tolerate what's happening in our mind. That's why we get distracted. We try to get distracted by looking at TV or looking at our mobiles and so on. Because I don't know how many of you observe, I think we torture ourselves through the thoughts in our mind if it goes unconscious. Okay, so how do we become aware of our own patterns so that we can, once you become aware of that, you can like try to break that pattern, and then the all the tensions, because whenever you have like a tension, we push it down, it becomes a pattern, and then it keeps on. You'll have the same trigger again and again and again. Something is bothering you from if your boss, same situation will keep on coming, you'll keep on getting irritated, you'll keep on getting tensed, stressed, it will only keep on getting worse unless you become aware of that pattern, and then you can decide that you don't want to get stressed in that situation. You want to let it go and then keep your peace. That way your nervous system also stays balanced instead of getting stressed, which leads to chronic diseases. So that technique we will teach in Antarmona, okay? And apart from that, we also teach like Shatkarmas, which is like the cleansing techniques, which are very, very powerful. For example, let's take like asthma is one of the common disease because of the pollution, right? More and more people are having getting diagnosed with asthma or like respiratory diseases. So asanas will actually help with that, and it opens up your chest, and then through pranayama we will also increase the prana, the amount of prana. Also, some of the causes of asthma is like external pollutants, right? Sometimes it could be pollen, sometimes it could be if you have pets at home, the pet dander, hair, all that gets into your nose and then it can trigger asthma. So we have like powerful cleansing techniques they can do like neti, which actually washes your nasal passages, okay? Because for asthmatic people, see, normally for a normal person, if a dust enters your nose, we'll just sneeze and then we'll go on. Probably we'll sneeze couple of times and then we'll become all right. But whereas for an asthmatic person, it actually triggers your nervous system, and then it will lead to asthma attacks, spasms in the lungs. So how to calm them, or how to get rid of the external the particles that entered in your system, in your nasal passage especially, right? We can get rid of that through neti practice, jalaneti practice, which we will be teaching. Apart from that, we also teach like Laghu Shanka Prakshalana, like we'll wash off the entire alimentary canal from your mouth to your anus using salt water. See, that again, it cleanses your entire alimentary canal, and for asthmatics, it removes the excess mucus that is accumulated in the body. So we'll be teaching a lot of like Shatkarma techniques also in this course. And apart from that, so I talked about Yoga Nidra, Antarmona, cleansing techniques, asanas, pranayama, relaxation techniques. For I think for asthma, we'll be teaching like Surya Namaskar, which is a very, very powerful techniques. So, and we will also be teaching like if a person has more than one chronic health conditions, how to handle that. For example, for asthmatic people, like we want to increase, they have a lot of kapha, that is lot of mucus. So we would like to give them some heating pranayamas and asanas that will actually generate a lot of heat in the body, right? But at the same time, if they also struggle with hypertension, how do we handle that? Because they become a little bit contradictory, isn't it? So as a therapist, if you want to help people, you also need to become aware of multiple conditions the person can be suffering from, and then give the therapy accordingly. Because one solution for one problem may not be appropriate if they have an additional problem. So you need to analyze all that. You need to understand the contra indications of each and every like asana or pranayama or cleansing technique that will be giving. Or even in the, for example, like, right, I talked about Laghu Shanka Prakshalana, which is like we use salt water to cleanse the entire alimentary canal. For asthmatic people, it is okay to add extra salt. But if a person has high BP and if you are giving that modality or that particular therapy to them, then we don't want to give them the normal amount of salt, because some people are sensitive to the sodium levels, which can actually increase the BP. So we need to modify that. So like all these minute details will be covered in the therapy courses in detail. And apart from that, nowadays most of us are sitting, unlike the Like 50 years ago, people were like, there was a lot of physical movements, but nowadays, a lot of us are doing like desk job. So what happens is if you're constantly sitting in one place, the muscles will get tightened up, and then, it will impact on the joints, because when everything is moving smoothly, right, like the joints also will function. If a muscle is in a one particular position for a long period of time, it tends to tighten up. Okay, that's why there is a lot of complaints of body pain nowadays, or joint pains, because when the muscle become tightened up, they are actually like pull on the joints. That's why we don't feel very comfortable walking for a long time. Even like small children, like like under the age of 10, like everybody starting to complain about like neck pain. Why? Because you are keeping this particular posture, right? So this is like the spondylitis and spondylosis, it begins to develop. Okay, some of them are age related, some of them are because of our lifestyle. Because you're holding a particular, if you're looking at the phone, then this muscle is going to get tightened up, right? Because you're only moving it in one particular. It's not meant to be like that. We don't stretch enough. Every day you're supposed to like stretch, especially people who are doing desk jobs, right? Because the muscle needs to relax. If it is constantly in one position, it will tighten up. Slowly, slowly, pain will increase. And if you don't like address it right away, the pain is going to increase and so on. Okay, so we also have like for different spondylosis, right, like lumbar area or cervical area or mid back, how to address that. We have asanas for that also. Because again, like for what movements are like recommended, what should not be given for a particular problem, all that will be taught in detail. So in general, I think in TTC1 we cover high BP, diabetes, asthma, and then spondylitis. So these four topics will be covered. And mostly the basis is like you want, like it's like a holistic approach, so you want to bring balance. Wherever there is a problem, first we want to make sure the prana is moving freely, and there is also sufficient prana in your body. And then whatever is accumulated toxins, I think first thing is like elimination of the toxins, right? Because we want to restore health in your body, so get rid of the toxins. And then like remove the blockages in the nadis, chakras, or different parts in the allopathy terms. Get rid of the blockages in the pathways of different organs, so that they can start functioning properly. And then increase the amount of prana through pranayama practice, and then get into deep relaxations through yoga nidra, through antarmona. You become aware of your own patterns, so that you can break those patterns and then get permanent relief. Because otherwise, like if you have like a problem, you'll go to the doctor, he'll give medications. Like if you have pain, it'll be over. I mean, like after 5 days of medication, you'll feel better, but next month again you'll come back with the same problem. So every time you'll go take the temporary relief, and then like this cycle will go on, and then the disease also will progress. People who are taking diabetes, slowly slowly you will observe that the amount of medication that you take is going to increase unless you change your lifestyle. And yoga actually gives you the mental strength, right? Because when you do all that, you also get the mental strength and the clarity, so which will help you to make the right decisions. Because a lot of times, like we don't have the strength, because like we have the weakness, and then we will keep on repeating the same thing. It's okay, I'll just pop a pill and then go on, and then it just goes to a limit where recovery is not possible. So whenever a disease starts, if you take the right action through yoga therapy, you can actually reverse most of the conditions. Okay, so this is the overview of what we are teaching in TTC one course. So if anybody has any particular questions like about the course, please feel free to ask now. What I think other thing, beautiful thing that we cover in this course is for each of these topics, right? Apart from yoga therapy, we also actually invite doctors from the medical field. They will also give you an overview about the physiology and anatomy of the particular disease. Diabetes, like, a doctor who specializes, like, in diabetes will come and take one class for you. So you get the knowledge because, see, at the end of the day, like, allopathy has done a lot of research, and then we have a lot of information that is beneficial. Even the, like, the test and diagnostic test and everything, right? We can use that because before, like, you start the therapy, you can have the basis, and with that information, and then you can give few weeks of like yoga therapy, and then again you can measure the same parameters. For diabetes, we all know, like, we to do the fasting sugar levels or HbA1c, and then postprandial and all that. So you can do that prior to starting therapy, and then give the therapy, and then take all these tests, and you will see the difference. Okay, so you'll also get the some of the medical knowledge from knowledgeable doctors also in this course. Okay, so no, you're not just getting the knowledge from Bihar School of Yoga, which is scientifically proven. Okay, there's a lot of research done. A lot of the books that you buy from Bihar School of Yoga, right? At the end of the book, you will find a lot of research details, how it was actually applied, how it actually works, like how actually pranayama, like for asthmatics, right? We don't use like the lower lobes of the lungs. How pranayama practice actually opens up the alveolus, the air sacs, right? If the air sacs only open up fully, all the alveolus open only, you can inhale a lot of oxygen, right? Because you want to inhale means the air sacs need to open up, because we don't use the lower, like, most of us are doing chest breathing because we are stressed. Okay, we are supposed to be doing abdominal breathing most of the time, right? But we don't do that because of our thoughts are running very fast. We're always stressed, thinking about that, this, or something in the mobile, because the rest time, the imbalance in the nervous system that I talked about, right? So we end up doing a lot of chest breathing, and the pranayamas actually help us to exercise each lower lobes, how to activate that, how to do abdominal breathing, how to do the chest breathing, all that, like, it will be taught. And how to stimulate the vagus nerve, because vagus nerve actually, it plays a very important role in relaxation response. So how some of the asanas actually stimulate the vagus nerve, or how it stimulates the parasympathetic nervous system, so that the relaxation response will come. So all that, like, will be explained to you in these classes. Okay, so you'll get the scientific, the allopathy knowledge, as well as the yoga therapy, so that you can combine them and then help the patients, or whoever your clients are, to get relief from whatever condition they are suffering from. Okay, all right, so now let's move on to questions. Does anybody have any questions?
Ma'am,
Hi.
Harivom, Namaskaram.
Namaskaram.
Your introductory session is very good and informative. And uh, uh, do we have to undergo this course online only like this?
Actually, before Corona, it was only like offline. I think after Corona, we
Okay.
started online, and people from all over India are able to participate in this course. So I think Swamiji has decided to continue this like online, so that even people from abroad are able to participate, like, from all, not just from India, all over the world, like, so I think it's done only online these days. But if you want like one-on-one like therapy, then you can actually like call the ashram, and then they will do one-on-one therapy. You can actually, anytime if you are in Chennai, you can go to the ashram and learn directly also, but not as a
Okay,
course
then one
for
more.
individual
Okay,
treatments.
okay.
Yeah.
Okay, one more doubt. You are mentioning about Shat Kriyas and all. So
Yeah.
is it possible to teach all these Kriyas online, ma'am? Because Neti and
No,
all
no, I think
mentioned.
Satkriya, usually what happens in this course, right? At the end of the course, we all go to Tiruvannamalai for like 2 days. We have an
Oh,
art in Tiruvannamalai. So
okay.
sometimes the Shatkriyas are taught there. I mean, like Lagu
Okay.
Shankar, we teach it online, but
Prakshalana you have mentioned, yes.
That I think we've been teaching it online because first we will cover the theory part one day and then teach
Okay.
asanas so that you become familiar. And then, like, on in the second class, you'll be taught. So because you become familiar with all the
Okay.
asanas. Yeah. Some are like
Ma'am, is it totally free, ma'am?
what is free, like the course?
Yes.
No, I think I think there is a fee. You can reach out to
Hmm.
the, um,
Office.
I think at the end of the thing, like
Session you will be mentioning. Okay, ma'am.
I'll mention
Okay.
the details who to contact. Okay.
Okay, ma'am.
It is actually a 4 months course and it's a very reasonable price. Yeah. It's a donation.
Uh,
Okay.
Ma'am,
Thank
ma'am,
you.
Good
I'm
morning,
Dr.
Vijay ma'am.
Manjari.
Yes.
I am doing MA Yoga Shastra from Kavi Kalidas University.
Okay.
Now in third semester, I would like to join this course. How to join it?
Okay. I think let me just share the flyer. So that I have a flyer. Okay.
Vijay ma'am, I have one more doubt because the session now it lasted for 40 minutes and I have
Yeah.
experienced a lot of disturbances. So is it possible for you to share the videos if possible?
I
Because
think free webinar is usually like it's recorded and shared, I think. Uh,
sometimes see I am also a doctor. See, sometimes I may get a case and I have to
no,
go
I
to clinic.
understand. I understand.
In that
Usually
case, it may not
free webinar
be
is,
possible to sit in front of the computer or a mobile and see.
yeah.
So in such case, we can actually listen for the videos.
Yes, yes, I understand. I don't know
Ah,
if Balamurali sir is online. Balamurali sir, are you there?
Hari Om Vijay ma'am. This is
Yeah.
Vanishri. I am the course coordinator for this course. Hari
Okay.
Om all. I am Vanishri. I am the course coordinator for TTC1 and TTC2. And my number is mentioned in the poster. If
okay.
you want, I will put my number in the chat box. You
Yeah,
can
please.
reach for any queries. Lahu Sangara Prakshalana is a part of TTC1 program that will be taken in middle of the course. And Swamiji is taking another course about chakras and prayers. That is also a course that starts that will go for 4 months. For any queries, please reach me. I am there for to explain.
Yeah, Vanishri, please
I
post
will.
your information in
Yes,
the chat.
I am typing, ma'am. I'm typing my number
Okay,
here.
okay.
Vijay ma'am, I had one question. This is Varun here. Good morning.
Yes.
Thank you for conducting this class today. My question is first, what is going to be the flow of the class, each class? Like,
Okay.
and
Yeah.
secondly, is food also a part of the class? And thirdly, what is this trip like? What is this visit that you just mentioned? The 2 day visit to somewhere to
Yeah, the 2 days visit, yeah, to the ashram. Okay, I didn't get the second question. What was your second
the
question?
second question is food and diet also part of the workshop? Food,
Who?
food and diet.
Food.
Oh, food and diet. Yeah, sorry. I think one thing I forgot to mention is in each and every, okay, the flow is like, okay, in each and every course, high BP or diabetes or asthma, we also include what kind of the diet is also included. I forgot to mention. Thanks for bringing it up. And also like for some courses like asthma, how fasting also impacts, we will be covering that. The flow of the courses, like each disease, like we cover like 3 to 4 weeks. So first we start with high BP and then diabetes, asthma, and then spondylitis. So in high BP usually we talk about, we'll give introduction about the disease, like some knowledge from the medical field, right, like allopathy. So what is high BP, the, like the structure of the heart and everything. Okay, and then we'll go into the yoga therapy tools like asana, pranayamas, and then yoga nidra, antarmona, etc. So every day we'll have like a initially theory class, followed by practical. Sometimes it will be reversed also, right? I think sometimes some students want to finish the practicals first so that they can eat and then listen to the theory. I think it's varies little bit. Okay, usually it's asanas and then like asana pranayama, and then like theory, and then there will be either yoga nidra or antarmona on alternative weeks, or sometimes you might have both yoga nidra and antarmona also on the same day. And there are also other like tools of meditations that we'll be covering, and then in between we will also cover Shatkarma. Okay, and Swamiji also will come and talk about the like if somebody has like two illnesses, how to take care of that. So every disease like it's like 4 weeks. I think the entire course runs like 4 months. So 3 to 4 weeks each disease, and then like at the end of the when we are covering finishing high BP, right? There will be like an internal via, because some of you want to become like a therapist, right? So we will also give you a chance to come and teach on stage to other fellow students, so that you become confident or you learn how to teach. Because we are not just, some people might just come to benefit themselves, but some of you are coming to teach others. So we also like train you how to teach, right? So how to give instructions, all of that will be monitored, and then feedback will be given, because contraindications, how you explain, because by giving instructions the other person should be able to visualize and then do the asanas or pranayamas. So we want you to be efficient, so we also give training for that. So that is basically the flow, and the diet will be covered for each and every disease. And the third one is like 2 days, right? At the end of the course, usually like we take you to Tiruvannamalai ashram, and some of the perks are like we'll go around, we'll do the Girivalam. I don't know how many of you are familiar, like go around the Tiruvannamalai, right? The temple, like which is like 14 kilometers. It was so beautiful. I think we did that like last February. I think people from different courses. I think ashram conducts not just TTC one. There is also a teachers training two course, mainly addressing like women related problems, like and then etc., like prenatal, postnatal, which is covered in TTC 3. And we also have like mudra courses, and like Vanishri said, chakra awareness program. So people from different groups come together to the ashram, and then we go around the Tiruvannamalai, like they do the Girivalam, walking barefoot around that, and it's a beautiful experience. And
Uh, is it,
yeah,
I mean, it's a beautiful thing. I think if I'm a part of it, I would love to do it. But is it also mandatory to do the
it's
thing
not
in?
mandatory. No, those 2 days are not mandatory.
Okay,
To attend there, usually you'll be getting the actual certificate in person. Like,
right,
usually
right.
Swamiji will host the final ceremony in the ashram there.
And this
And
is
like,
in Chennai.
it
This is
is
in
in,
Chennai.
no, the ashram is like 3 hours from Chennai.
Okay,
Tiruvannamalai, yeah.
okay,
So that is not mandatory. I think if you're not able to attend, you'll get the certificates in WhatsApp or, in other means.
right.
Yeah.
My last question, ma'am, is that is there a particular reason why these four diseases have been clubbed together for TTC1?
These four, I think TTC1 was started originally. The most common problems, right? Like high BP and diabetes, asthma, and then, spondylitis. And then later on, I think there was like a lot of inquiries where for like, women related problems like PCOD, infertility, and other things. So slowly, I think TTC2 was added, and then TTC3 for prenatal and postnatal. And like ashram keeps on adding courses nowadays, like based on what's becoming more like prevalent in the society and so on.
So, so
Recently,
I'm sorry. My
yeah.
question is that is there any particular reason why these four particular diseases have been clubbed together, or this is like a random selection of?
I think when we started this, I think these were very, very common problems, right? Like diabetes, high BP, and asthma also keeps kept increasing. But I think recently what we are seeing, like other like the women-related problems, especially like girls, like PCOD and other things, they became a little bit more. See, diabetes and high BP were there among the most population before, but a lot more problems keep on coming. So I think based on the current needs and inquiries of the people, right? So the first one, I think what was determined at that time, those four were clubbed together. So we keep on adding more.
Thank you.
Yeah. So any other questions? I think, yeah, we have like maybe 5 more minutes.
Ma'am, what about the practical sessions, ma'am? I'm very particular about that.
Yes, we have.
Uh,
Swamiji is very particular about the practical sessions. That's why every class we have like theory plus practicals every week. Okay.
uh, okay, practicals every week. Ma'am,
Yes.
can I add some points to that question raised by your TTC 1 and 2? Because how I can feel, see, mostly in our clinical practice, the heart problems, high BP, diabetes, asthmatics, and spondylitis. All these are all related to more stress nowadays. So our bigger school of yoga, they rightly combined the TTC course for high BP, heart, diabetes, then this spondylosis, because they're all mostly
Yeah.
lifestyle related disorders, and also they are actually triggered by trigger, though they may remain in the dormant state, but they are getting triggered, and we often get in our daily practice mostly
Yes.
cases like this. And you have clubbed gynecological cases separate because that is the different system, and we have to do a lot of things. So that is why 4 months it is entirely dedicated for the gynecological and women related. Similarly, the prenatal and postnatal, it is again the entirely different world, and it has to do a lot of things. So I think our Swamiji Gambhirananda ji has rightly classified all these diseases according to the need based, and also based upon the causative factors and based upon the triggers. So it is very perfectly classified. This is my humble understanding, ma'am.
Thank you. Thank you. Thank you for
Hari
sharing.
Om, Vijay ma'am, this is Kavita here.
Hi,
I just
Kavita.
want to take that question and thank
Thank
the madam who just explained it. Yes, you are right. Why this is combined? Because not because it was like, picked up randomly. As Vijay ma'am said, it is the most prevailing diseases and the root cause. We always look at things, and the root cause is the lifestyle, right? By changing the lifestyle, we can reduce stress and the occurrence of these diseases. So these are all actually psychosomatic diseases, which are actually, affecting the mind, and then, it manifests as issues in the body. So changes at the mind level, changes our lifestyle can have a huge impact of either avoiding these diseases or even preventing them, and even managing them if you already have it. Yes, so the TTC1 courses contains lifestyle related diseases, and TTC2 is specially focused on women related problems, which it will be followed by this webinar. I will be taking up that details. And the third one is on the in the women problem, the most important, the most auspicious, or the special time period is the pregnancy. So we want to give that women the empowerment to the women to train themselves, to manage the pregnancy through prenatal, taking care of prenatal and postnatal through a separate focused agenda. So that is the reason why it is of 3 different, sections as courses. I hope this clarifies. And thank you again for adding that note.
Thank you. Yeah. And also in the Mudra course, we cover the mudras for all the TTC 1, 2, and 3. Okay. So in the TTC 1, 2, 3 courses, like we cover asanas, pranayamas, yoga nidra, like, all the meditation tools, antarmona, everything, cleansing techniques. So Swamiji introduced a new course last year, Mudra course, which addresses the mudra technique for all these diseases. So there, TTC 1, 2, 3, all the diseases are combined, and the mudra therapy for that is given in separate mudra course. I just wanted to add that. Okay. So I think I'll give the session. If there are no other questions, I'll hand over the session to Kavita. She will be covering the TTC2. What are the diseases covered in TTC2 now? Any last question? Probably I'll take one last question if there is any. Okay. All right. Thank you all. I hope the information was beneficial, and it's a very beautiful course. I wanted to, I think I personally, I want to say, I also I teach asthma in this course in TTC 1. I've also done my thesis on asthma in my master's in yoga, right? Because asthma actually runs in my family, and I personally like benefited myself. I used to be on inhalers, and I also gave the therapy for my son who was also struggling with asthma. So, like, so the amount of inhalers, like, like it's very, very rare occurrence for my son where he needs to take, like, the inhalers. And I actually have stopped taking the inhalers. So I think the yogic attitude, right? I think you need to develop that, and it will automatically develop once you begin to do these practices, asanas and pranayamas consistently. You will get the mental strength that you can beat any disease. Okay, allopathy can say a lot of things. Yes, it is possible. It is not possible to cure. You can manage the symptoms. At the end of the day, the mental attitude, the yogic attitude that you will develop through all these practices will help you to reverse some of the conditions, provided you are consistent and you are determined to cure whatever happens in your body. Okay, so with that, I will conclude my session. Thank you all for your time. Arihom.
Thank you,
Hari
ma'am.
Om, ma'am.
Thank you.
Yeah,
I have one final question. Sorry.
yeah,
Uh,
sure.
if we opt to do come for the last valedictory function to Annamalai, or I mean, I'm sorry, to
Tiruvannamalai. Yeah.
Tiruvannamalai, yeah. So, will there be any kind of help if we need accommodation or something?
Yeah,
Because
accommodation, food, everything is, like given by the ashram. Yes.
oh, only for the person, or if they come with family, then
I think you're welcome to come with family also. I think I've seen people come with family as well, but I think
okay,
please double check with Vanishri because
okay,
the rooms are limited there. Okay, so I think please check with the course coordinator about that. Okay, yeah,
sure, ma'am. Okay, thank you so much, ma'am.
yeah.
Ma'am,
Thank
how
you.
will you assess, ma'am? How will you assess? That is also one important question.
The assessment, okay. Oh yeah, we also conduct like see, we have like we'll ask you to teach then Viva practicals, right? You'll be teaching on the theory part. There are two exams. Those who want training certificate, right? Those who want certificate, okay, you need to write exam. Okay, there will be like one more question for 100 marks, and also you'll have like long answers. Okay, so if you are only coming attending this course for to benefit yourself and you don't want to, go through the exam, you can opt out. You can inform the course coordinator. Okay, but if you want to get the certificate of the teacher, then you have to go through all of that. Okay, the Viva where you'll be actually teaching the different techniques of asana, pranayama, yoga nidra, or antarmauna. And then you'll also be writing theory questions, one more questions, and long answers. Okay, and you'll be given marks, and then you'll be given certificate accordingly. Yeah.
And also you will prescribe appropriate books also, no, for the same?
Yes. The books are so beautiful. I think, like, written a lot of books are written by Swami Satyananda Saraswati, and then for different therapies, like by other Swamijis. Yeah, we will refer for each and every course what book you need to buy.
And also you give any study materials also, apart from the
Study
prescribed
materials also
textbook.
will give the videos that of the class also will be
Oh,
provided until the end of the course. I think you will have access to all the videos. Every
okay,
class
okay.
is recorded and you'll be given access. You'll be also be given assignment. So, the recommendation is like, listen to the videos again and again while it is made available,
Yes,
and
ma'am.
we
Yes,
go
ma'am.
from there. Yeah, and then refer to the books, finish the assignment so that you get the thorough knowledge. Okay. Yeah.
Thank you so much, and thanks for the opportunity to explain why
Thank you
the
all.
TTC
Thank
1,
you.
TTC 2, and TTC 3 are classified.
Yes.
Thank you so much.
Okay. Kavita, thank you. And you can take over the session. Hari Om all. Thank you.
Hari Om, ma'am. Thank you so much.
Hari Om. Let's give it a few
Hari Om.
minutes. Yeah. Hari Om, let's give it a few minutes because the seminar is scheduled to start at 9, right? So there may be people who are joining at 9. So please stay for a few minutes. Hari Om.
Hari Om.
ma'am. Hari Om.
Hari Om, everybody. Can you hear me? Can you see me?
Hari Om, ma'am. Yes, ma'am.
Yes, ma'am. Yes,
Hari
ma'am.
Om, ma'am.
I think you would have already gotten the introduction about Shiv Darshan Yoga Vidyalaya. But let me do a quick recap. Ranishi ma'am.
Yeah, ma'am. Hari
So
Om.
yes, ma'am. The Guru Parampara was already introduced.
No, ma'am. You can like continue the session, ma'am. I will tell at the end, ma'am.
Okay. Let me share my screen. Let me know if you're able to see it.
Yeah, ma'am. We can see.
Okay, great. Okay, as you can see in the picture, right? Welcome you all to this webinar on the TTC courses conducted by Shiv Darshan Yoga Vidyalaya. You see our Guru Parampara here. Are you able to see my screen? Just to double check.
Yeah, sure, ma'am. We can.
Yes. Okay. Yoga is the heritage of yesterday, the science of today, and the culture of tomorrow. That's what Swami Satyanand Ji said many, many years ago, but which is true now. The great yogi of modern times, Swami Shivananda, was actually born in Patamadai, Tamil Nadu, right? Very close to where we are from Chennai. And he was actually a doctor by profession. He was practicing in Malaysia, where he renounced his practice and he established the Divine Life Society in the year 1936. He authored over 200 books and he attained Samadhi in Rishikesh in 1963. The picture middle that you see is Paramahamsa Swami Satyananda Saraswati. He was born in the foothills of Himalaya in the year 1923 and he joined the Guru Swami Shivananda in the year 1923. Swami Satyananda founded Bihar School of Yoga, known as BSY also, in Munger in the year 1963. He also founded Sivananda Math and Yoga Research Foundation. He attained Mahasamadhi in the year 2009. And you see Swami Niranjan Saraswati, who is the current chief of the Bihar School of Yoga. The below pictures are our dear Swami Vajrapani Saraswati and Swami Gambhiranand Saraswati. Swami Gambhiranand Saraswati joined Bihar School of Yoga in 1967 and he was initiated by Swami Satyanand Saraswati in 1969 himself. And he was handling various activities at BSY, including the construction of Ganga Darshan building. And he founded Shiv Darshan Yoga Vidyalaya in the year 1992. Swami Gambhiranand Saraswati joined Bihar School of Yoga in 1979 and was also initiated by Swami Satyanand Saraswati in 1983. And she was heading various activities in BSY from that period onwards. So, Swamiji, in this fast-paced world, right, realize that people are losing touch with the balance in the traditional life and finding more comfort in junk food, mindless entertainment, overindulgence of senses, right? That's what we are dealing with. So they have been striving to instill and develop the personal values, the harmony, and mindful living through various yogic practices, teaching them in this ashram in Chennai, like asanas, relaxation techniques, meditation, etc. So I welcome you all to Shiv Darshan Yoga Vidyalaya. Now we are all online. You're welcome to connect offline also in our Shiv Darshan Yoga Vidyalaya ashram at Chennai. So we have various courses as Vijay ma'am just said, we used to conduct physical classes before. There are still regular classes happening for children, for adults, for therapy, and various courses as well, as you see here. TTC1, which we talked about just now with all the details on lifestyle diseases. TTC2 with women-related major problems, and kids yoga, which is specially for children. Children are our future, and we want to catch them young. So we have this course for children, mainly for yoga teachers, even parents who are like interested in teaching their own children, and other people who are interested to dealing with children and catching them young and giving them that empowerment of yogic skills, even from the young age. We also have other courses like the special pregnancy period related ones. Previously, during the pregnancy period, prenatal and post-pregnancy, postnatal as well. There are other courses conducted by the ashram, which is on chakra awareness, mudras, and Patanjali Yoga Sutra, which is the authenticated text of yoga, one of the Shaddarshanas that has been taught in detail, understanding and applying Yoga Sutras in your life. So there are certain advantages that I would like to highlight being a student and a teacher of Shiv Darshan Yoga Vidyalaya. This course is completely designed by Swamiji. This is a course curriculum that is formulated based on their learnings and experiences of many, many decades. And the teachers are all trained by Swamiji and who take forward this course. It will be direct under their supervision and their guidance. So we actually have a holistic approach to this. We also traditional methods and scientific methods, which means that we do have people visiting, like Vijay ma'am mentioned, that it's like allopathic doctors to give you the latest scientific edge to it, and also coming the BSY traditional way of approaching the ailment as well. You will have hands-on experience. There was a question just now, I think somebody mentioned about is there any internship? We do not have internship, but we will give you an experience of an internship by giving you a project, taking a live example, a project, a mini experience for you when you go to the outside world to teach, in order to understand the ailment totally, understand the patient, their lifestyle, and come up and design a course plan for them, teach them through a period, observe the before symptoms and signs and values test by various tests, and then the post values to compare the progress and their improvement. So you will have a very good experience by the time you come out of this course. You will have also a viva, because a lot of communication is informed. It's not enough you understand and you know it. If you have to communicate to the person who comes to you, communicate the disease, the onset of the disease, from why is it happening, and they're explaining to them. So very important viva is you'll be assessed on your ability to communicate, and corrections wherever possible, wherever it's required. Thank you, Tripti ma'am. Yes. So you'll be guided. So this will be this is not like a course that you finish and you get your certificate and go off. This will be a guided course where you are. This is called TTC, right? We are training the trainer. You are a trainer already, maybe, right? The trainer is the purpose. TTC course to train you to give that advantage, to have the confidence to go to the outside world and carry on this therapeutic course. So again, you can connect with the ashram, stay lifetime connected. We have also have alumni group, and any assistance from Shiv Darshan will be always available for you from expert guidances from Swamiji. And you also can volunteer to become a teacher after your course and upgrade yourself and be part of this courses and learn as you grow. So special training on Yoga Nidra and meditation, which is also part of this course, and a special course also, you will have an opportunity for that as well. So these are various pictures from our Sunni to share that various dignitaries who have visited the ashram. You will see the courses that is conducted in corporate, etc. One thing to mention is just not like an institute. This is an ashram. So I would like to repeat that here a guru parampara, a guru shishya relationship is developed, and an ashram experience will give you an added advantage of learning. Yes, these are the courses as I mentioned. The course contains asanas, pranayamas, bandhas, mudras, mantras, chanting, and kirtan, because bhakti yoga is an integral part of the spiritual experiences here. I'm sharing you some researches that we have done. As I said, we have a scientific approach. We conduct researches on the effectiveness of this therapy, because we want to prove scientifically with our traditional methods how we can help the mankind, humanity, with coming out of this ailment. Okay, with that, can we move on to the women's health? Are you all ready? Do you have any questions so far from what was shared? Can I get a thumbs up? Can we move on? I would like to keep it interactive. Yes, thank you. I see Sai Pravina. Thank you. Okay. So again, welcome you all to this women's health. Women, in Tamil, we have this saying that, Madarai Pirandira Madhavam Seda Vendum. So which means that to be born as a woman is such a boon, right? Yes, she goes through a lot of physical and mental, physiological changes and difficulties, but then to be born as a woman is a boon, is what we say. So yes, so the women's health is very critical, and every person actually has a woman associated with them, and then through your lifetime, you also see them go through various stages. So we want to address this women's health as a concern, because with all the problems that is happening currently, the lifestyle diseases that the woman is facing, we want to give an edge over that and help people come out of this problem in a very scientific and a very traditional way. So a woman's life, as you see, right, from 0 years, from a baby, right, and through the ages of puberty, pregnancy, motherhood, menopause, or the old age, and find the elderly age. So in this time, right, the body and the mind goes through a lot of changes, and each one comes up with its own problem and associated, complications. So talking about, let's go back to the infancy just to understand infancy at each age, right? Infancy is basically when the child is exposed to the surroundings, and there's a lot of social and the emotional growth. This actually very strengthens the bonds within this. This is a very important stage in infancy, which is focused on adequate nutrition, right? For the baby, the girl baby, nutrition is more important. Sleep, and the children need a lot of warmth, attention in that age, and which will actually impact their social behavior. When it comes to puberty, which is as the girl grows, the body rapidly changes a lot in many ways. Psychological changes, physiological changes, the body shape changes. There is a growth period there, and then first period, emotional development. So a lot of things happen for that change. And the child sometimes is outgoing, will share, but then during puberty, some suppress them and keep it with themselves and go through these, not knowing how to handle these changes as well. Again, a very well-balanced diet with adequate intake of calcium for the bones, etc. is required with a lot of love and care. As we move on, we come to the reproductive age, where the woman blossoms and right now, right? The girl blossoms into a woman, and pregnancy, maternity are the very crucial stages in this age. And it's very joyous and a very fulfilling moment for every very pregnant woman, or even the woman going through that reproductive age. But it is connected with a lot of potential health issues, a lot of discomforts and diseases that can happen. So it's very crucial to be preventive. So in Tamil, we have the saying, right? Varumun Kapo. In English, we say prevention is better than cure. In Patanjali Yoga Sutra also, we say Heyam, Dukham, Anagatam. So avoid the problem before it comes. So a regular screening and watchful health checks will help to diagnose any problems if the woman has at the earlier stages, and give them both physical and mental support to go through them and recover from them. As the woman grows, they come to an elderly period, which is actually a post menopause period, menopause, perimenopause, menopause, and post-menopause period, which is where when actually they don't have a period, not so frequent periods, and sometimes a period that's not coming in a row for about 12 months. During this time also, there is a lot of symptoms like hot flashes, a lot of things happen within the body and are more prone to diseases like osteoporosis, heart diseases, Alzheimer's, even, there are so many diseases that that the woman goes through. So it's extremely important to keep the mind and the body very, very healthy. So through these phases, how are we going to help our women to wellness? So women's wellness is our key focus right now. To be given support socially, they have a lot of challenges, occupational challenges. We have to give them a total solution for this: physical, physiological, environmental, spiritual, emotional support. And yoga, through yogic practices, we can provide them a better mental health. Stress is inevitable, but then we will enable them to manage stress better, increase their physical and mental strength, build body flexibility, improve their digestion, food habits, trying to manage pain, if any, a stronger spine, physical strength, remove inflammation in the body, give them more energy, and avoid from any diseases like, the cancer risk or any other women-related cancers are so common these days. Every other person is affected with ovarian cancer, cervical cancer, breast cancer, etc. Right? So how can we avoid that? That is the main purpose that we want to. So this course is designed to address the problems that they already have, number one, or to prevent them before it comes. As you all know, yoga is two ways. One, it was a preventive science. Yoga was part of the lifestyle where you do it as part of your regular abhyasa. Abhyasa was part of your regular daily routine, part of your dinacharya. Now that yoga went out of our dinacharya, problem came in, now it's becoming therapeutic. So preventive has become therapeutic. Nevertheless, yoga is still a biggest empowerment that we can give our women to address their problems. So let's look at each one of them and how we little information about that, and then how we help them to move from illness to wellness. So are you all with me so far?
Yeah, ma'am.
Yes. Thank you so much. Moving on. So the first one is to understand the menstrual disorders that the person goes through. The child actually matures into a adolescent. That is the age called the puberty age. And during this phase, tell me how many people have heard stomach pains, school-going children having periods, either periods with not consecutive, but then comes within few months, heavy bleeding, discomfort, all this. Do you all know such people in that? You have known people? Either could be your own.
Yes, ma'am.
Could be your own child or yourself, or even your friend's child, somebody who consults you as a teacher, as a doctor. I'm sure you are hearing this. And now we see that people attain puberty very early, right? The food, the lifestyle that makes the puberty is so advanced now. And there is also a case where their puberty is very delayed. Even at 17, 18, they don't attain puberty, or they attain puberty very early in the age when the child is hardly understanding to handle that menstrual period. Menstrual period needs a lot of care in terms of physical tiredness, how to handle that menstrual period, right? So even that physically, mentally, the child is not ready, but then the body is already producing those hormones, right? So we need to understand that. The first thing is in this course would be about the understanding the menstrual cycle and the problem that it comes with it. As we always approach everything to understand from a scientific. So you need to understand the physiology. What is a uterus? The various part of the uterus, the hormones that is secreted. And this, we saw this HPG axis. What are the hormones secreted and what is the impact of the hormones And what is a menstrual cycle, right? So if the hormones are not secreted, the cycle goes haywire. The 28 day cycles becomes either no menstruation or excessive menstruation, menstruation across many months, or menstruation within months. There are several conditions: amenorrhea, oligomenorrhea. These are things you will learn, because when people come to you, they will tell you the first thing you would ask is when was your last menstrual cycle? So when they tell you the timeline, you should already know that what is the condition that you are dealing with. So a good understanding on the menstrual cycle, along with the education on the uterus as a physical structure and its function. So we have anatomy, the structure of the uterus, and also the function, which is the physiology. Like it produces the female egg cells. It is the one who transports the eggs to the site of fertilization. And what are the female hormones for the reproductive cycle, etc. And understand puberty. So these all are part of the menstruation, and then we explain the phases like follicular phase, ovulatory phase, luteal phase, etc. Right? These are something that we all of us have studied during our 10th or 11th standards, but then with different courses that we have taken after that, our different streams of education and career, we probably would need a refresher, which will be given to you. So understanding the problems that can happen during this, right, could be cramps, tenderness, bloating, and even psychological, like mood swings, very irritable. You probably don't know why the child is behaving with tiredness and irritability, and they may have headache. So the symptoms can be physiological, all can be psychological also. So for a woman, it's usually about 3 to 7 days, but again, it depends on the person and the problems they are facing. It can be 1-2 days, or it can go on for a week or so, sometimes 10 to 11 days also. That again, depending on the hormonal balance that it has. So the types of premenstrual, the menstrual disorders that we may have is called PMS. We may have absence of menstruation, the various problems that each person will go through. You will go through them and the yogic practices. When we say yogic practices, we will go through what it means, because again, it is a total solution, not just asana or not just pranayama, like that. Okay, so we will give you a total solution. So you are given that advantage of the entire solution for them. So it is not a band-aid fix. Just where there's a problem, fix it. Where there's a problem, you firefight it. It's not like that. Total solution from physical, physiological, psychological, emotional, the entire way to handle the problem. So this is about, and of course, as we also mentioned, that pranayama for that particular disorder will be different from other pranayamas that you will learn. So across all these diseases, you will have a separate session on asanas, pranayamas, bandhas. That will be for that particular ailment. So yoga helps. It's a time-tested tradition, as we all know, and it helps women to live a healthier life. And especially menstruation and menstrual period is something that they go through from the puberty to menopause. There's a long phase in the child's or in the woman's lifetime. So this will give them the strength, the physical and the mental strength to go through this period with an advantage. Moving on to the next one is the next problem. Yes, now the child has attained puberty. Yes, then the next one is sometimes you have complication in the puberty, the menstruation cycle, and which actually leads to a condition called PCOS. PCOS is actually polycystic ovarian syndrome. We always hear PCOD also, which is polycystic ovarian disorder or disease. These are actually used interrelatively, but they are actually different, because PCOS is a syndrome, which means it is an umbrella of diseases. So a person may have PCOD, or they may have other diseases also, along with the symptoms. So basically, PCOD is actually a heterogeneous disorder, which is actually interferes with the metabolic activity, and then it hinders the reproductive activity. So the person can have polycystic ovaries, are usually characterized with amenorrhea, with some symptoms like hirsutism, which is the growth of hair in the body, and obesity, insulin resistance, etc. So here again, the understanding of the menstrual cycle is very important. And the symptoms are very, very classic, which we already know. Some people may have obesity, some people may have facial hair. So by looking at that person, just by observation, because as you all know, right, in yoga therapy, observation, darshanam is very important. By just looking at the person, but the way they walk in, or the way they sit down, or the way they are breathing, right, from their hair to the skin structure, everything you can see that what the problem is. Of course, then you can move to the sparshanam, which was actually a traditional method of, touching and finding out, and of course, nadi pariksha. These are methodologies in the therapy. But even darshanam, when looking at them, even through online, you can already tell that through the symptoms, what are they going through. And of course, you have tests to find out, scans to find out whether there are cysts. Polycystic ovary. Poly means multiple, more than 1, more than 5, more than 10. Cannot count the number of cysts. It forms into a cyst, right? Small follicles, a fluid-filled sac forms, follicles, becomes into cyst. Polycyst happens where? In the ovarian, and syndrome because it has a group of disorders. So you will understand how to, many conditions are there, how to confirm it is a polycystic ovary, because they'll come to you with reports. Here is my hormone report. Here is my estrogen level report. Here is my scan of my uterus, abdomen scan. You will be able to, you'll be first you need experience, but we also know that from these conditions, there is a very unlikely case of a PCOD. So this is a condition that we need to deal with very, very urgently, because over time, the very critical factor is the person won't even know. They just think they missed their period, they just missed their period. But then 75% of the women having polycystic will not know until they reach the age of, or until they, can somebody answer? They will realize the irregularity of periods until they want to
Carry.
Yeah, want to get pregnant.
Pregnant, yeah.
Right? Until such time, they won't really care about their, it is not a problem at all. Because, it just comes, it doesn't come, there is pain, yes. But when you want to get pregnant, it becomes a very important cause for infertility. And then you start, there's so much of anxiety, married since so long, so much of pressure, social pressure, peer pressure is there that, I'm not able to conceive, not able to have children, because then they go back to find out that they have PCOS, and then find out the root cause and start to handling one there. But ideally, you should already be monitoring as a parent, as a teachers, as even school teachers, like, or even they must have the education. Right now, we have so much of education shared in so much of media that you should be aware of this condition where it doesn't become a problem too late in the game, where then you're dealing with it emergency. So you will be able to taught how to identify this, what are the conditions that will cause it, what are the symptoms that you can identify, because we believe in finding out the root cause of the root cause, not just arresting a symptom. So if you have a headache, taking a Crocin or any particular paracetamol will arrest a symptom, but the root cause of that headache could be many things, from smallest indigestion to a largest brain tumor. Happen, but we don't arrest symptom, but then try to go back and understand where the root cause is. And also we have a circular, right? We say Noi Nadi, Noi Mudal Nadi, Altanikku, Vai Nadi, Vai Pachayal. For those of you who don't understand Tamil, it is telling, it's one of our, it's a couplet called Tirukural, which is saying that find out the root cause. Don't arrest the symptom and take action on the root cause so that it doesn't come again. Right? So if it depends on the condition, how early you catch. If it is chronic, acute, or it is only in the early stages. So then don't arrest the symptom, but arrest the root cause. So that is the methodology that we will follow. Any questions on PCOS? So asanas will be taught and practices, again, pranayamas to increase your digestive fire. to increase the blood circulation around the reproductive area, to decrease the obesity, which is a very important cause for PCOS. Even a reduction of 5% of insulin resistance, obesity will have a good improvement in the menstrual cycle. If menstrual cycle is normal, the hormone levels are normal, and the menstruation cycle will go through, and the hormone secretion and the chances of releasing the egg and fertilization is more possible. So with this, we will move on to the next phase, which is the menopause phase. This is again as a pre, during, and a post phase. Are you all with me? Do you have any queries so far? Let me stop here to check if you have any queries so far.
No, ma'am.
Okay, so we go on to the menopause now. So meno means month. Month, actually the word month, the root word is meno from Greek, and the pause means, we all know, right? Stop. So basically it is a cessation or a stop of the menses. That's why it's called for a year. Typically, if it's more than a year, then it's called menopause. And it's basically the end of the women's menstrual cycle. So before this happens, there is again changes that the woman goes through. Okay, and very not very easy. And during the period, during the menopause timeline, and then when after the 12 months, it is marked as the menopause period, and it is actually the end of the reproductive years. You're done with any more reproduction. So what happens actually during this time is the natural declining of the reproductive hormones. So that is the start of 40, slowly, and the very, very minimal cases of where their deliveries happen during that age, and then slowly it reduces. And as you approach over 50, then becomes the less and less estrogen and progesterone, which are the two hormones that regulate the menstruation. Again, you will understand you already have the knowledge now by the anatomy and the physiology of the uterus. That will give you an added advantage. And it's very important because this age is actually very prone to many issues. So it's very important to address women's health issues at this stage with a lot of care. So pre-menopause, perimenopause, menopause, actual and post-menopause. There are several stages, and as you are nearing the menopause age and as you are going through this, there are a lot of changes. And how to identify the signs of menopause, right? So you may have poor sleep, you may have hot flashes. So a lot of mood changes, all that symptoms will be taught to you, so you can easily identify them, and how to balance our emotions, how to balance our body composition, different vata, different doshas, right? From an Ayurvedic angle will happen also. And most important is nutrition, the food, the diet. So what are the minerals, nutrients that you would need during that time? So you will be given advices to eat those wholesome foods. Sattvic food is the norm, is what we were asked to follow, but more enriched in vitamins and minerals during this time. And what to avoid. Just as you are told what to eat, you will also be advised on what not to eat, right? Because avoiding is something that is actually good at, is a very good effect as well, right? If you avoid, you actually reduce your risk of having that disease. And again, mudras, pranayama, asanas will be taught during this section also. Moving on, finally, is another condition, the uterus prolapse. This is another condition which is very painful. Again, a problem that the person deals with, and it's actually a struggle. Not very many people feel very embarrassed sometimes to tell you that, but it is something that we have to deal with and help people with this condition, giving them the strength to go through this particular period. It may be not very common from people, you probably not very common those days, but now we hear that there is very common disorder called the
uterus pelvic organ prolapse. What happens actually is the pelvic floor, which actually it's actually kind of like a hammock, right? It forms a hammock, like, and it actually gives up or becomes very, which actually loses strength. The muscles around the pelvic organs loses strength. So the organs around the pelvic organs are, anybody? What are the organs around the pelvic floor? Checking.
Reproductive organs.
Yes, uterus. Yeah, just not only reproductive, right? How about bladder? Bladder is also there, right? Your rectum is
Yes,
also
the
there.
urinary bladder and the
Urinary
excretory system. I
bladder,
mean the small
rectum.
colon and
Very good. Yes, rectum, small bowels, all these are there. So it's just beyond the uterus. There's other organs also around the pelvic area. So you need to understand that, and because of this disorder, right, that then their function may be interrupted. It's not only uterus, right? So there will be a pelvic organ prolapse, urinary incontinence, right? Or even anal incontinence, where the ability to control, because of the strength is lost, there will be the strength of the other organs also will be lost. And it can be very, very so much of painful and discomfort for the person. So prolapse actually refers to the drooping or coming down, or eruptum we say, right? It's something that falls down because of the strength not there. So when the organs around this area droops or descends, this is called a prolapse. So as you see in the picture, how the uterus actually designs into the vagina. Sometimes it may even come out. So it can actually happen in any age, but mostly in the postmenopausal period. So again, it has 4 stages, how it passed through from the upper part to the completely, sometimes out of the vagina. And there will be heaviness, the bowel movements may have a problem. So there are so many symptoms that the person will go through and may not even share with people, being embarrassed to even say. And there are a lot of risk factors with an increase in this condition. So there are ways to prevent this by strengthening the muscles, right? There are asanas to prevent this condition by making the pelvic floor more flexibility and support given so that it can support these pelvic organs. So yes, these will be the composition. So basically a woman's health starting from puberty to the menopause and prolapse, plus one more important that I wanted to cover is the thyroid. As we all know that thyroid is a very, very important gland, and it's like a master gland. It takes care of all the metabolic activity. So thyroid, we will also cover thyroid as a section in this course, so that you have the total understanding of the thyroid gland, its function. Sometimes it's lower secretion, sometimes it's a over secretion. So you need to understand the thyroid, the location of the thyroid, what does it do, what is the function of a thyroid gland, and the anatomy of the gland, the location of the gland, and what are the hormones it produces, and the impact of the T3, T4, the hormones, and how does it, again, the HPT axis, like how you would learn HPG axis. HPT is the hypothalamic pituitary thyroid axis. You will learn that the hormones being created and the effect of the hormones. And you will see that the asanas around the neck area are being focused on this asanas. The movements around the neck areas and the pranayamas that is required, because it is very important to know thyroid, because it affects the puberty. It basically affects the entire life cycle we talked about from puberty, right? From puberty, it can happen early because of the thyroid problem. It can happen late. So both it can affect. So it can have a very light, just spotting kind of a flow, or it can happen a very heavy flow. So any imbalance in the thyroid organ will affect the puberty, the menstruation, reproduction to a great extent, because it will affect the ovulation and the release of the egg for fertilization. So, and again, thyroid will have a major role during pregnancy, because it can harm the fetus. It can have problems during childbirth, and deficiency of thyroid hormone can also cause miscarriage or a preterm delivery. or a stillbirth or a postpartum hemorrhage. All these are complications, and it's so important. I can't explain the importance of thyroid gland enough for you to understand and to attend to this hormone and make sure this is in balance. And last but not the least, thyroid disorders may cause an early onset of menopause. Typically happening 50, can happen in 40 itself, and menopause, early menopause will have its own complications itself. So, overactive thyroid or an underactive thyroid is definitely a problem. Again, the symptoms, you will learn how to identify the symptoms of thyroid, the changes in the weight, changes in blood pressure, hair loss, so many changes you can find. So the types of thyroidism you will also run when it is underactive, what are the diseases? When it is overactive, what are the diseases that can happen? So both conditions can happen to a person, and it can be very similar. Like a weight gain, we think obesity, it could be any reason. It could be insulin resistance, it could be thyroid. So again, the symptoms help you to identify, of course, again with the help of tests and mostly from the person, right? Understanding from them, their lifestyle, what is their symptom. And it will give us an advantage to handle thyroid and attend to this. And typically, thyroid hormone test will actually, or thyroid antibody test will help us to identify and confirm the thyroid disorder. In our therapy, we will associate this with the Vishuddhi Chakra, the psychic center, the transform. It is said to even transform the poison from the body into Amrit. That is the power of the Vishuddhi Chakra. So practices will be around that area for this particular, all ailments around this. Okay, so now we actually had a good idea of all the ailments that we will go through. So now it's the turn for us to find out how are we going to handle it? Tell me how. Now we have listened to what, we have listened to why. Why should you? Because it's going to affect the quality of life. How it is going to in fact, the longevity if it leads to risk of cancer, etc. But now, how are we going to deal with this is what we are going to learn. And as I said, lifestyle changes. It is very, very important. The person, you have to commit to lifestyle change. So any amount of asana you do, any amount of pranayama is not enough unless the whole lifestyle is changed. Healthy dietary habits is again, will complement it. Food is very important. Low fat, low carb, low salt. Anything will reduce obesity, will have a good impact on any of these diseases. And more nutritious, more sattvic food, right? More fresh food will help in the recovery as well. And in the yogic practices, we have asanas and kriyas. Asanas will be taught for various ailments along with kriyas. We just talked about the one of the kriya that we have Shad kriyas. On the Shad kriyas, we will be doing few of them during there will be online also and during our face-to-face sessions. As part of every course, as Vijay Madam mentioned, there will be an opportunity for you to join us in the ashram in Tiruvannamalai, the holy place, one of the Jyotirlinga place. The ashram is located in a very serene location. It's a very great opportunity for you to connect there. You will also get to practice there as well. So that is to remove the toxins in your body, Laghu Shanka Prakshalana, and will help you to remove the toxins from the body. How much of a medicine you take, if there is toxins, right, the absorption capacity actually will be enhanced only if you have a cleaner or a detoxified system. So asanas, kriyas will be taught to you. And when asanas are taught, we are monitored, right? We are online also we are monitored in smaller groups on how you do it through your videos only. And if you are taking online classes also, we will teach you how to monitor, right? Because it's important. I will tell you that no match to a face-to-face session, but then with technology, if you are able to help somebody who's not living close by you, you're more than welcome. But then there is a technique or there is the way to observe them from your own observation and from their experience as well. So kriyas and asanas is one way, and then pranayama to give you to increase your immunity power, to strengthen the system. You will be taught pranayama practices. along with bandhas. Bandhas are psychic knots, and bandhas and pranayamas to give you their advantage. And mudras, special mudras for ailments are also part of the, Vijay ma'am explains that the separate course on mudra to understand the effect of mudras on these ailments. Meditation as in japa meditation, several meditations, and also including yoga nidra, which is the greatest gift from Swami Satyanand Ji to the mankind. It helps you to relax the body. It rejuvenates the entire body. A few minutes of yoga nidra is equal to many hours of sleep. Sometimes you wake up after sleeping for 6 hours, so tired, right? How many days have you wake up tired? But then after yoga nidra, you will wake up such rejuvenated, both mentally, physically, and you will be ready to start your day or to any time to relax as well. And all the suppressed emotions, the psychological ailments, it'll be like deep-rooted ones can be like, uprooted using the yoga nidra practice and chakra meditations, etc. We offer a lot of courses on this for from a mental aspect. And spirituality is an integral part, because a lot of times that that we are like running behind so many things, so many wants and needs, and then we are moving away from spirituality, understanding who am I, what am I doing here, what is my purpose of life, and what is that I'm going through, why me, right? There are so many questions that you ask yourself, and then through spirituality, through bhakti yoga, through understanding who you are, through understanding the transient nature of this world, you will have such mental clarity on to understand not just this problem, any problem, the mental clarity is important, that you have a mind of a stable mind and have the ability to take forward any challenges. That equanimity of thought, right? Samatvam, yoga, uchyate, right? Samatvam, the balance. Yoga is all about balance, right? Balance of hormone. In sama dukkha, right? Even if you don't jump in joy, you don't sink in sorrow, you eat balance, right? Your senses are balanced, or the entire balance. It will bring out your best potential and bring the best version of you. So version A person is 1.0 becomes 1.01 and 2, 0, 3, 0, 4 into a whole new version with these practices. Okay, so I'm done with all my sharing that we have on this course. And the objective here is just to bring an awareness that this is being offered, right? For you to know that this is something that we are dealing with, and I would really appreciate each one of you who made this effort on a Saturday morning to understand what is this about, right? So it's really a blessed opportunity, and my sincere thanks and gratitude to Swamiji for giving this opportunity to share this information, that what is being offered at Shiv Darshan with utmost care to humanity. With this, I would like to request to you to share your feedback or any questions you have, or any queries on this course on or anything that we just talked about. I'm putting the contact information. It's in Chennai. The telephone numbers are there. Vanishi ma'am, maybe if you can also
Yes, ma'am.
share the pamphlet. It will be used while we answer the questions. You can also share if you want. I will stop the sharing.
Ma'am, excuse me, ma'am. Ma'am, is this course covers the uterine fibroid?
Not this one, but that is one of the conditions that you will have during the menstruation cycle. Yes, but not in detail. That is something that we can consider. We will take this as a feedback. Thank you for raising it.
But it is nowadays it is a very important role in fertility. That's why I am asking.
Absolutely. Thank you for raising it. Yes, currently this is already the content, and yes, maybe as part of the menstrual disorder or as part of fibroid, we could consider that also. Thank you for raising it, ma'am.
Thank you, ma'am. Thank you, Ramesh.
So, there was another question whether it is a. Can you somebody help me to read the questions? Is it online? Yes, it's online also. It's online also. The classes are online. So those of you who have joined, was not in the previous session but have joined now, I would just like to share the way the classes are conducted. each section will have a theory and a practical session, and also will have the Yoga Nidra and meditation session as well. And the assessment will be based on your assignments. You will be given topic to research and present. You will be given projects. You will also have Viva sessions, as I mentioned, because we want to see how you have understood and you are able to communicate. Because we cannot come with you to every class that you take, right? So we want every teacher to finish this course and go out with confidence and start healing the world. Okay, so you will be having a Viva and written exam also to evaluate your understanding. The purpose is just to evaluate your understanding and your confidence level to take forward this therapeutic session. And therapy is very, very different than, you may already be a yoga teacher. Many of them, I think, in this webinar are already yoga teachers, but handling therapy is not like picking up a ready-made dress or something that is a t-shirt which is like a generic size. If I am a size between XL and XXL, both may fit me in a different ways, but yoga therapy is like tailor-made. It has to be for one person. It has to be, you have to be learned to understand that person's composition, that person's heredity, that person's occupation. What is the job like? What are the heredity? What is the thing that they deal with, their profession, everything, and then come up with a course plan for a time period that is required. And each course plan is very different. It has to have different factors from asana, pranayama, bandhas, and food, diet, etc. So the course plan will have to be a good way for you to come up your therapy session. So the course, so each section will be of few classes, and then there will be a Viva for every class that finishes, and then at the end there will be an overall Viva as well. So the assessment will be very helpful to you. So you don't have to be stressed or be worried about the exam. The purpose is only to ensure that you have a good understanding, and we are here to help you to correct or validate your understanding, and then so that you are able to take forward, right? That's the objective. When you finish the TTC course, you have to be a therapeutic yoga therapy teacher for this particular ailment with confidence and with all the knowledge that you need. And of course, you will acquire it slowly over experience as well. But then we have to give you what is being offered. Any other questions? Again, I would really thank all of you taking this time off and attending this session. Yeah, you can type in your numbers and your or contact information in the chat if you want us to reach you. We have also shared the numbers. If you want any other questions, just let us know. We will be happy to help you.
Ma'am, may I ask one question? Ma'am, since you said it's therapy is tailor-made, so do you also teach yogic counseling? Because since we just discussed that things could be psychosomatic.
Oh yes, because yes, when it is a one-on-one session, it does involve because yoga is a lot of mental level, right? It's mind management. Correct?
Yes, ma'am.
So,
Yes.
Very important for the person to understand, because you can teach them, they will say, and then how they follow it. They need to understand. You need to inform. You need to communicate that they are doing this for their well-being. Today you are here, but then 3 months from now, with your effort, you will make a difference, right? It will take so much time because it is taking so much time for you to come with the problem, right? It will take you that much time for you to go away and gather the mental strength to go through it, right? And this too will pass, right? This is something that gives them the mental strength also, and avoid further complications. I told you about hey dukkha managatam, right? And when you come out of it, like abhyasam, practice is important. Abhyasa vairagyabhyam tan nirodha. That's what Yoga Sutra says. With dedication, you must do your practice, and with a good understanding, with the right attitude, right? It's satu dirgha kala. The practice is done over long period of time with the right attitude and a good effort. So even as with food, right? You have to look at food in a way that it is healing to you, not food that is just, giving you satisfying your craving. The food has to give you nutritional value, right? You have a lot of choices. Sometimes there are many worse choices. Choose your best choice among the worst choice you have. So develop the relationship with food that if you eat the right food, the food gives you nourishment. If you eat the wrong food, the food actually eats you, right? So the development towards food, right? In fact, in ashram, we call food as prasad, right? We don't say food, we don't say pongal, we say prasad because that is an offering given to God, thanking with gratitude to the divine and taking food with humbleness on whatever we get, right? And then take it with nourishment. With so much of vibrations go into that food becomes medicinal value. Food is thy medicine. But today people take medicine like their food, right? So many grams of medicine they take because of their lifestyle. So yes, the mental makeup also has to be changed for a long term. If you say they only come to class with you, they come to therapy sessions with you and they only teach you and the practices and they go back, right? They won't be motivated. Sometimes they get pain, sometimes they don't, they will discontinue. They won't even come back. You teach them Surya Namaskar, they get exhausted, I say they won't come back. But understanding it, understanding the science behind why we do what we do, understanding the long-term benefits, not the short-term pain, but the long-term benefits of this consistent practices is something that you will have to talk to them and you will have all this information. You can only tell them if you are convinced and you have learned the science behind this and the age-old tradition that we carry forward. Yes, very good question. I'm so glad you picked it up because sometimes mental health or mental is taken so deep down the list when it comes to, because people think yoga is done on the mat, but actually yoga is done off the mat. Your approach to life or a typical day is based on how you handle things off the mat, how you respond to situations off the mat, right? And I would like to share one thing which is very, very close to my heart because I'm pursuing PhD on yogic practices and especially on middle-aged women and especially on stressed working women and especially on counseling techniques. So I'm glad that you would pick up this topic, and this is what I have dealt with, and I've seen the immense benefit of counseling, giving them the strength to go through what they go through in this all these ailments with strength and gives them the empowerment. So that is the power of therapy, right? Therapy is not giving you this pill, magical pill. Therapy is giving this magical skill, that skill to manage any situation. One pill can address one problem, but that skill can understand, can go through, can overthrow many problems. So that is the power of the skill, mental skill that you will be giving them to go through this. I think, sorry, counseling is my very close topic, so I can't talk enough about it.
Thank you, ma'am. And ma'am, will you be there for the TTC too? I mean, you are one of the main teachers there. Thank you, ma'am.
I am. My blessed
I
opportunity.
have a few questions, ma'am, if you don't mind. Yeah.
I don't mind at all.
Will you include post-menopause topics as well? Because many of my students are in their 50s and they always have these issues with weight gain and how to reduce weight, insomnia. Will you also include that?
As I said, menopause has stages, and then all the 4 phases actually be covered in menopause. So yes, it's not easy at all. People are struggling. There is pre-menopause, there is perimenopause, there is actual menopause and post-menopause. Until end of life is post-menopause. That is the largest period that they have to deal with all the mental strength that they need, right? So after 52 plus, this actually happens usually. And yes, the symptoms are really, sometimes unable to explain. The family needs support as well, right? There is irritability, there is anxiety, there is headaches, and it needs a lot of social support as well. Together, I think the family also has to be supportive to go through this condition. Yes, it is also handled as part of the menopause section of the TTCQ.
Okay, thank you, ma'am. Just a very quick question on the course itself, couple of things. Will you be providing the books or the content material? Because I don't live in India, so how would I?
Where are you from?
So I live in Hong Kong. I'm from India, but I live in Hong Kong. So how will you be providing the content?
Okay, books. We have a huge inventory of libraries from the Swamiji. Okay, so you will be prescribed. Of course, there are main books which will be called like the main books are like the APMD, which is the Asana, Pranayama, Mudra, Bandha, where all our references to the practices will be given. Okay.
Okay.
So, but that is available online at the ashram. We can send it to you. That is a book that you can carry for life. Okay. So that is one reference. But there are separate books for certain ailments like women-related disorders separately also. Besides that, whatever is being taught will be given to you as notes, as PDF. Okay, for your reference.
Okay, that sounds
Because
good. Yeah.
you may not be able to observe everything, right? You may not be able to digest all the information, and sometimes you're focused on writing the notes. Sometimes you may not able to,
Exactly.
right?
Yeah.
So we totally understand that. Yes, but it will be shared during the when one particular subject is over. Because sometimes when the notes is there, you always feel, okay, let me look at it later, like that, right? So we don't want that. We want your commitment to that session, because yeah, recordings are also provided, but then being an interactive session, being able to ask the question that comes in your mind right now, the availability of the person teaching is important, is also important for for you to have this recording also and this material also with you, so that you can for your reference. Okay, and because there's a written exam also, reference to this. And also, your extended learning is important. Please open up your extended learning. Of course, today there is so much of media, there's so much of network to find out more things. Yes, please do your research also. Learning knowledge is advantageous, and knowledge becomes wisdom when you apply it. As you teach, as you apply, as you experience more and more people with different experiences, you also grow in experience as well. Yes, I hope that answers.
Yeah, thank you so much. That's all I had.
You're welcome.
And at some
Maybe
point, I
time
would love
difference,
to visit your center.
Thank you. Sure. Please drop by. Please, plan next time when you drop by. I guess there'll be a time difference for you, I think, for 2.5 hours. Yeah, I guess you need to manage.
That's fine, but because it's during the day anyway. Yeah,
Okay.
that was the other thing. If, what is a class length usually? Because it should not become monotonous sitting in front of the computer for 4.5 hours.
Yes. It'll be very interactive and participative. Like, we make sure that, you are there, awake and alert and aware of what is happening. Okay?
Yeah.
Yes, it's not
Okay.
easy to be usually on a Sunday, right? To be attentive, but then we will make it attentive, because you have to be engaged. It has to be interesting for you to be participative, right? So we will make sure all that. You just have to lend us a ear and your eyes. We will make sure that, it is participative, interactive as well. Okay?
Thank you so much.
Yep. And yes, so we've had people from Canada, especially from London, where there was a lot of time difference. They will wake up early morning, 4:30, 5:30, and to match up with the timing. It is a challenge for people with different time zone, but I guess nothing is impossible.
That's right, ma'am. Where there's a will, there is a way.
Absolutely.
Thank you, ma'am.
Any more questions? I can take a few more. I think we are just running close to the closure time.
Ma'am, amazing presentation, because I missed this when I attended this course. I missed this presentation, so that's why I came. And I was to have attended PTC 1 pre-course. So at the moment, I got a client from Delhi, so he asked me without prior appointment. So I'm forced to take class for him right now. So I missed the first class from 8 to 9.
Oh, okay. That was PT1. Yeah, okay.
Yeah. And shall I talk about this course? Because I attended this course, that you taught me all these things.
Yes. Oh, yeah. I'm a proud teacher. Instead of, of you. Because
I always tell everybody, you, just Srija ma'am and our the hot shouts of Shivadarshan. What I'm trying to tell is, after passing out this particular course, I'm getting a lot of questions of this category, the menstruals, the thyroid, menopause, PCOD, all are coming in. Even I got a course on that prolapse case also.
Okay. Yep.
It's an amazing course, and when you are all there, no, so how can see? That's why I'm attending each and every course. When you are there, then the other ma'am is there, Srija ma'am is there, Shashi ma'am is there. Yeah, all are amazing.
Ranjit sir is one of our star students, and he comes already with a lot of experience, also from a different tradition also, but then he's absorbed all the information, and as he said that, he's helping so many people, both offline and online, and trying to help people with what he has learned. Yes, thank you for sharing,
Thank you.
sir. And it's a blessed opportunity to help somebody heal, right? The fulfilling feeling of helping somebody, relieving of their pain is like matched to nothing, I would say. It's very fulfilling feeling.
Ma'am, one question, like you had written, you will be teaching bandhas, because that's something many people are not teaching nowadays, like pranayam with bandha. So
Yes,
like it will be there.
Yes.
Okay, thank you, ma'am.
Which is the Mahabandha, the combination of all the three bandhas is called Mahabandha. All that will be taught.
Okay, thank you, ma'am.
Because
Thank you
it's
so much. Such a
required.
wonderful session. I mean,
Thank you.
like, I never thought I would do any TTC, but like, I'm so motivated after listening to you. Thank you so much.
That's the purpose. Your name, ma'am?
Kavita
I'm
ma'am,
Tanveer.
Kavita ma'am, let me share this one because Kavita ma'am taught this Tanveer ji. So she's
Okay.
an expert in executing all these bandhas. Amazing.
Okay, okay. Yeah, thank you
Blessed
so much.
opportunity again.
Thank you.
It's a
My blessed
pleasure. It's a
opportunity.
pleasure.
For me, it is so fulfilling to know somebody who has recovered, and no match to anything, I tell you. So healing, I mean, healing is really, you're chosen to heal, right? Not everybody gets this opportunity to heal, right? So please do reach out to us in any way. I mean, just take note of the timeline. The courses are happening every few months. So plan your schedule, and it is a challenge. I mean, but then you will see the benefit that you get as a person yourself, and the skills that you learn to impart to others. So it's very important for you to have that confidence to take this forward. I really wish everybody very good, a successful enrollment if you're able to, and then plan for it sometime and gain this knowledge, help people and heal people. That's the objective, right? To reduce this pain, right? Reduce the suffering of the humanity, right? Is the main purpose. So yoga is actually reduces the suffering of the person, right? Because of the giving that physical and mental strength to overcome these difficulties. As we said, it's also a psychosomatic disease. People deal with a lot of mental issues that manifest as body problems in the body. Sometimes you don't know why you have the problem because of, it could be you could be eating the best food, you could be living the most clean environment, but then with the mental trauma, so much of stress, not being able to understand, the happenings. Always there is like a depression, sadness, either anger, those suppressed emotions. Sometimes it is worrying about the past, what happened, why did it happen, or sometimes it's always worrying about what will happen in the future. That anxiety. It's either the worry about the past or anxiety about the future, and we lose this present moment of being in the now. That is the purpose, to bring the mind to that calmer state, to help us to heal, to reach that yogic state of yoga, chittavritti nirodha. So managing the mind, right? That is the main thing. Thank you again. Thank you all. Looking forward to hearing from you. You can reach out to help you.
Thank you, Kavita ma'am. Hariom all. I am Vashi, course coordinator of TTC1 and TTC2. And I have posted my contact number in the chat box. And as well as I posted the poster also. You can see the video, recorded video in Shiv Darshan, SHIV Shiv space Darshan in YouTube. I share the link also in the chat box. This is the website, official YouTube channel for Shiv Darshan. You can see the recorded video. Ranjit sir, you can see the recorded video in this session.
Sure, ma'am. I was looking forward for that one.
I will share you the link also. I have shared the link in the chat box also. And I have mentioned my number in the chat box. Feel free to call me or message me for any clarification. And I am also the student of Shiv Darshan. I feel so confident after finishing the therapy sessions in Shiv Darshan. I was teaching so many years, but once after I finished my therapy, I got so confident in dealing with any type of patients. So with comorbidities, I can easily handle. That confident I got from Shiv Darshan only. So I'm very confident. You can join the course and you can learn a lot of things. All our experienced teachers under the guidance of Swamiji, you will learn a lot of things. And feel free to contact me for any assistance from for TTC1 as well as for TTC2. And there will be assignments and project and final examination to get the teachers training course certificate. And attendance is also important, but Swamiji personally thinks a therapist should know each and everything clearly. So that's why attendance, making mandatory, one video off and one leave is that you can avail. That is not a problem. And any more questions, any doubts?
Yeah,
Based on your
Swamiji,
marks, based on your marks, there will be grading
Hari
will
Om.
be 50% is the pass mark.
Hari Om, ma'am.
Hari Om,
Swamiji
Swamiji.
speaking.
Swamiji is there.
Hari Om, Hari Om.
Hari
So
Om.
I am Swami Gambhiranand from Shivdarshan Yoga Vidyalaya.
Hari Om,
Whether
Swamiji.
you
Hari Om.
heard, I thank to Kavita ji and Vijayalalita ji today who gave you information about TTC1 and TTC2 and given their auspicious valuable time for this webinar. And also Vanishri, she is our coordinator for this course. Whether you join this course or you don't join this course, I just came in to invite you for Guru Purnima. And during Guru Purnima, we are doing very special sadhana shibir. That is morning 21st, it is Sunday, falling on Sunday. And if you are a yogis and if you are a shishya, it is very important day for the shishyas. And this 10 o'clock to 3:30, we have sadhana shibir. So we are teaching you different practices for your sadhana, which you can take it with you and practice it every day. And after that, we have 3:30 to 5:30 our puja and other function program, validatory function for the previous batch people. So I just wanted to invite you for Guru Purnima. So those who are interested, they can enroll. It is free of cost. Those who are interested, they can enroll. Those who are especially in the Chennai, if you are interested, you can enroll for that. So 10 o'clock to 5:30, you have to be here on that Sunday. You have spent with me most of the time of your Sunday. So if it is possible, you please come to the ashram and see it is how it is our ashram here. And then we are organizing chakra meditation class also. It is very higher practice. Along with the chakra, this time we organized Kriya Yoga class also. So this is, you have to be with me every Sunday, 6 to 7 p.m. For 6 months. So this course, these two sadhana courses, which they say yoga, which you are learning in TTC1 and TTC2, therapy courses to teach others. And as Kavita ji already explained so many things about it, and you also know that it is related to tension and how you, all the tension when you reduce by practicing yoga, you can get rid of your health issues. Because when you're practicing yoga, it's a byproduct. This definitely you will get rid of your health issues. And it is directly hit to your mind. It is not for the body. It is yoga is for the mind. So how to channelize the mind? Yoga Chitta Vritti Nirodha, that is a sutra of Patanjali. So this sadhana shivir, I am mostly those who are interested, please come to the ashram. And this chakra meditation is online, but this Guru Purnima program is in ashram. So those who are interested, please contact Vanishri. She will give you other details and you please come for the Guru Purnima first and then decide for the chakra meditation. Hari Om.
Hari Om.
Hari Om. Hari Om.
Hari Om, Swamiji.
Hari Om. Hari Om.
Hari Om.
So Kavita, you are coming on Guru Purnima 3:30 to 5:30.
Okay, Swamiji. My
Okay.
blessed. Okay. Hari Om, everybody.
Okay, Hari Om, everybody. Please welcome to Shivdarshan Yoga Vidyalaya. You get the address and location, everything from Vanishri.
It's available
Hari
in the chat. She's just posted the location, the website, her contact number. Reach out to us. as I told you, the objective here is the awareness, more than, and then this is another opportunity. Swamiji invited also personally for the Guru Purnima celebration. So please, please let us know how we can help you. Okay, kindly reach out. We will help you with your queries. I hope the session was useful, and let's conclude session. Everybody, please sit comfortably. Your head, neck, and spine straight. Hands on your knees in Chin Mudra, Jnana Mudra. Shoulders relaxed. Our deep gratitude to the Swamijis who spent their lifetime giving us this divine education. Let's submit ourselves to their lotus feet for saving the humanity from suffering. Om Asato Ma Sadgamaya Tamaso Ma Jyotirgamaya Mrityorma Amrudangamaya. Om Shanti Shanti Shanti. Hari Om. Hari Om Tat. Hari Om Tat.
Hari Om, ma'am. Thank you.
Thank you, everybody. Have a good day and weekend ahead.
You too, ma'am.
Please note down my number and contact me. Please note down my number 9789066132 and contact me for any queries. Thank you.
Vani ma'am, I shall join you tomorrow morning at 8 o'clock.
Yes.
Bye. Hari Om.
Hari.